Yeah, so it's not even just C-sections, right? It's
Hmm.
definitely vaginal births too. Every woman will separate their abdominal muscles. So as your belly is growing, the line down the middle, that linea alba, it's the connective tissue, will separate to a certain degree. Some will come back together. Um, Postpartum, it can take up to a year, though, for it to come up together or back together without doing any rehab exercises. And so the research has really changed.
Welcome back to another episode of Beyond the Birth Story podcast. If you are joining for the first time today, I'm your host, Alexis C. Girl mom, angel mama to one of the sweetest boys in heaven, birth trauma and uterine rupture survivor, and former NICU mama. Here you will have the opportunity to ask and have your burning questions answered by professionals, feel connected to other women's experiences as we normalize the different aspects of this journey we are on as moms. The real and raw moments of healing are shared here as we navigate loss, embrace strength, and find hope again while learning to live after loss. Please note the topics discussed on this podcast are for educational purposes only. Please see your personalized medical professional if you have any questions or concerns that arise from listening, including diagnosis and treatment. It's nice to meet you.
Yes, likewise.
I'm trying to think who it was. Somebody on my personal socials had shared your page, and I was like, and then obviously I got into the rabbit hole of looking everything up, and I was like, oh, I'm going to reach out. So I'm glad I did. And thank you for agreeing to chat with me. I'm super excited. I feel like pelvic floor is such a big thing that my girlfriends and I are talking about these days, especially after having multiple babies. And so I know we cannot be the only ones. And so it's so
Yeah.
fun to have someone who specializes in that area to kind of share your vast knowledge with us. And I cannot wait to hear everything you have to say. So, without further ado, do you want to give us a little background on who you are, what your business is, that kind of thing?
So yeah, Ashley Waterman. I am a registered nurse and I've been practicing for about 12 years now. I am also a mom to 3 boys, so of course have my own experiences with birth, and I do work in the public sector as well. My primarily focus has always been with pregnancy, postpartum, and so I taught prenatal previous to having kids. And then after experiencing a birth, my perspective changed. Even my approach to how I educate clients. And I really found that piece was missing specifically for the pelvic floor, right? The
Yeah.
education that we provide and just telling people to do Kegels is the go-to. And even with saying Kegels, still many don't know what that is. They don't know what their pelvic floor is as well. So just having conversations to bring light to different topics, things that we often don't talk about. So I began after my first child looking for a course that I could take. Nothing really popped out to me. So it did take me about 5 years to finally find one. And then it was like this mini course, 6 sessions, like half an hour sessions, and I didn't even get through all 6 of them. By the third one, like light bulbs was going off, and I'm like, oh my gosh, why is nobody, connecting these dots and talking about this? And so, I signed up for that course then. And it really, I felt, changed my practice and really tied in the mental health perspective as well too, because we often look at things just in isolation, and it never is. It's multi-factor in our body. And so, after I took the course, of course, it was high COVID times. I was on a mat leave. I presented, my thought to the director at the time, and my idea was that I would go back to my public job and would be able to incorporate it in my work, would be able to get referrals similar to a lactation consultant, but
Okay.
specifically with the pelvic floor. But it's not easy to just, do that in the public sector and to basically create that into my position. So that's when I decided to do it privately, casually, and build it from there. I'm not to replace a pelvic floor therapist. There's so much benefit of getting that internal assessment, especially, but there's a lot of work that you can do even without having that internal done. So, I built, prenatal classes specifically of that information tailored around the pelvic floor. But really my services can be to anyone who's looking to build their knowledge on the pelvic floor and looking at that whole body approach more so. So I've began in 2021. And then still kind of felt restricted though by my practice with being a registered nurse. I'm very regulated in what I can and can't do. And so my regulatory body suggested that I get a physician to, to oversee my practice, and that would expand it. But I am very independent and I didn't want a physician to oversee my work. I do think that, of course, there's a time to that collaborative piece, right?
Yep.
But, so then they suggested that I take my nurse practitioner. At the time I was like, no, I've done enough school. I don't have interest in that. But then, of course, with being back at work over a year, reflecting, and I'm like, okay, no, I think I need to do this. Then that's where I'm at right now. I am almost done. I feel like it's going to be done this year. Still a lot to go, but it's on the home stretch more so.
That's a
So
big deal. That's a huge
yeah.
undertaking, especially 3 boys. You're working, you're trying to do all of these other things. That's amazing that you went back and, took the leap to do that.
Yeah, so it's I feel at a point right now, of course I'm gaining the knowledge from a primary care perspective. That's the program, the nurse practitioner primary care provider. So it's how can I blend, integrate what I've learned with the pelvic floor stuff, into practice, right? So I'll really have to sit down, once I'm done, and plan how I want to do that,
Mm-hmm.
in a sense. Because there's so much information of the courses that I've taken, even the sexual medicine course that I've done specifically with all the pelvic floor disorders that they talk about and different tests, and there's different pathways for diagnosing. So it's, how do I apply that into my practice now? So, it's exciting, but there's still a lot of work to be done, and lots of awareness to bring forth. Yes.
Absolutely. You're going to have a
Yeah.
very unique perspective. So I don't think locally, I know we have pelvic floor therapists and we have nurse practitioners, but we don't have any that kind of focus in on that, maybe women's health specifically, and then the pelvic floor too, right?
Yeah.
Um, do you think you'll just do pelvic floor, or will you try like as a nurse practitioner, can you integrate prenatal care or anything like that?
Yeah,
Oh my
yeah.
gosh.
It can be all of that. And so I feel like I'm at a point right now is I don't know what direction I want to go in
Yeah.
with learning everything. It's really an all ages,
Yep.
what I'm learning. And so I don't know if I want to just focus on women's health or it's good once you're starting off to be more of that generalist, and then
Yep.
as you get more experience to be more specialized. Um, so yeah, I'll kind of just have to see how it goes and where it takes me. But during my practicum experience so far, like the prenatals that I've done, I've loved it. Um, Again, there's definitely room for improvement in the sense of
Yes.
what is standardized in those appointments and what we could be offering, though, right? But
Yeah.
not every primary care provider has that additional training and knowledge. So that's where it can differ of what you get at your appointments, right?
Yeah. And you're just
Um,
going to offer something so much more than maybe everybody else, right? With having that extra education and that other lens to look through, right?
mhm. And
That's
I
amazing.
find people don't often know what they need, right? When you ask them, do you have any questions or concerns? They may say no, but once you actually ask the specific question and they're like, oh, well, actually, yeah, I do have leaking, or,
Yeah.
I do feel a heaviness vaginally, right? So when you ask those specific questions, then it just opens the conversation for further education, and then that you can refer them to the appropriate person as well.
I think it's so hard too in pregnancy and, prenatal and postpartum to know normal versus abnormal. And normal in the sense, do I have to live with this normal, or is it a normal, symptom of pregnancy or from pregnancy? And then what can we do about it? But a lot of the times I know for me, I'm like, oh, that's just normal. We'll work through it and it'll go away eventually or, whatnot. And so a lot of the times I don't even know the questions to ask. It's like,
Right.
yes, this is a
Yeah.
concern, but for so long, like I know I even prenatal appointments will say, oh yeah, lots of hip pain or, pelvic pain. Like, oh yeah, you're pregnant. That's normal. I'm like, okay, so I'm just like not gonna walk for the next 5 months. Like, and so
Yeah.
again, that lens to look through. And
Hmm.
two, as a woman who you've taken all those education courses, but you've also bared your own 3 children. And you said in the beginning, it changed your perspective. And it so does having a provider that can relate and understand to the physical symptoms you're going to. Like, I absolutely loved my male obstetrician and things like that.
Hmm.
But he was very much like, you're pregnant. It's normal. I'm like, okay. You obviously never carried around this baby.
Hmm.
So I think it's so important that women are stepping into these roles and not just like your regular primary care provider. You're doing, some of the specialty courses and putting yourself in a position to broaden what you can offer to women. And that is so important to set you aside, especially when there's so many people that you can choose from for your care.
Hmm. It's it's hard to when you are a practitioner and you see the same thing over and over, because then you do sometimes tend to minimize things as well too, right? Or
Yep.
dismiss it in a way that, and you group it into normal. Like
Hmm.
and I don't like using that word normal, or like what you should, I guess, expect in the certain time frame. Things are common, but yeah, you shouldn't have to live with that, right?
Hmm.
Or yeah, the hip pains is a little of course, very common, right? But there's certain things that we could do to for those adjustments and to make women more comfortable, right?
Yep.
Um in that sense, and like some have that hip pain postpartum for so long and don't know, like their hips may be actually out, right? And to get those adjustments to help and to that rehabbing, right? We don't think of it just because births have been going on for centuries, right? That how many have experienced it, but again, I think we need to do better for women's health in general. Even a lot of the research, right, hasn't been women based. It's been men in the studies. I think we're doing better now the last, even I want to say like 20 years, right? With bringing the awareness to that. So it's definitely a time where I don't know if it's just people I follow too, but seeing the conversations on women's health in general.
I absolutely agree.
Yeah.
Maybe it's my algorithm. I don't know.
Right.
I'm all about the women searching, especially with this platform. And then, it's just all of these women doctors coming up on my page. And I shared one about, again, you shouldn't have to white knuckle it through normal things. There's things you can do. And so I shared it. And the doctor messaged me and was like, thank you so much for sharing this. I'm like, thank you for sharing this. And I think we obviously have doctors on a pedestal in life, and we very much respect them and what they have to say. And so the fact that so many professionals are stepping into the role of social media, because it obviously is such a big thing, and using their voice, because the moment I see Dr. So and so, I'm like, oh, what do they have to say about this? I'm like, okay, I'm dialed right in. And then I absolutely love that the conversations are happening, and it is such an isolating thing, yet almost every single one of us are going through something similar after having babies or during pregnancy. You'll talk to your neighbor and they're like, oh my gosh, me too. Like, really? Because at that moment I thought it was just me, yet I'm not the only one who's had hip pain or leaking or things like that. And I think for me too, specifically, as soon as I'm not pregnant, I just assume my body's just going to go back to how it needs to be. And I remember after I had my last baby, and I had him in June. This was in September. And I woke up one day, I couldn't walk. I was having excruciating pain. Got into the chiropractor emergency, and my hip had come out of its socket, rotated into my pelvis. And I, literally couldn't move. And he was like, what did you do? I'm like, honestly, nothing. I just woke up. I'm like, maybe it happened in pregnancy. He's like, you know what? That could be it. I feel like I always assume that you did something today to cause this. But, you grow these babies and you stretch and move all of your internal organs and things like that. Times 3 for me specifically. He's like, no wonder these things are going to show up, and maybe not the day after. In my case, it was months after. And I'm a C-section mom times 3. And I don't know why in my head I was like, oh, I'm not going to need the pelvic floor because, well, I didn't birth out of the canal. But nonetheless, my hip stretched. I still had all of that weight. And so, I seen a post the other day. It was like, C-section moms need pelvic floor physio too. I'm like, okay, I'm starting to believe it, because I'm getting those signs and symptoms that maybe I need some investigation into and some interventions. But you mentioned internal assessment versus external. So you do the external. What does that look like?
So I do a lot of focus on the movement, the breath work, posture. And so the breathing is the primary connection with the pelvic floor muscles, the diaphragm with your ribs and everything. So really looking at that initially and making sure the person understands that they're coordinating their breath properly. Many people don't actually breathe correctly, which is also an interest of mine. And even like sleep apnea and myofunctional therapy and the way that the tongue positions, like that is all connected with it. And so, yeah, I look at that initially and then looking at posture changes. So sometimes even just watching somebody walk, or I will get them to take pictures of themselves too. So it's making these little changes. And so it is habits that we develop and that we compensate for. So even with you saying with your hip, and yeah, you're 100% right. It's not necessarily going to show up that next day. You were compensating over time, and then finally it just gave, right? So yeah, it's very similar with somebody saying like, well, I'm not leaking now, but like as we age, it can develop at a later date, right? And so looking at a lot of it's pressure changes too, that our abdominal canister, I guess you could call it. And so yeah, can you manage pressure effectively as well too? Do you even know what, what I mean when I say pressure, or if you're putting pressure down, right? So yeah, incorporating too, lots of people think it has exercises, it has to be going to the gym. But really getting people to understand or to do the exercises, like when you're unloading the dishwasher, or you're picking up the stroller and you're putting it in your vehicle, or doing the laundry, right? So you need to be able to, it's not just doing the exercises, like whether it's me or that physio is giving you. Can you do those exercises effectively, though, in your day-to-day life? Right? And the more that you do them and bring the awareness to it, then it does become habits. But that does take, right? So yeah, I look at, it's more just like little tips in a sense that you can incorporate into your daily, because most from what I found don't like doing the exercises, that physio may give, or even the handouts that I give. It's boring, right? So if you think more like in the sense of practical, it tends to go a little bit easier than when you can incorporate it that way.
Yeah, and I think that's important for, busy moms, obviously, too,
Mm-hmm.
right? Like,
Yeah.
I don't necessarily, well, I solo parent 95% of the time, so my husband works away, but I don't have time to leave my house and go to the gym or those kind of things. And majority of the time, Case doesn't like to be put down. And so whatever I'm doing with him attached to me. So
Right.
and
Yeah.
then by the time he goes to bed at 11 o'clock at night, there's no way in hell I'm doing exercises. And
Yeah.
so I know I can't be the only one. So being able to incorporate them into those things that we're doing every day, the dishwasher, the laundry, picking up or putting down our kids, that kind of thing, right? Or even on the floor playing with them, what can we do? And it needs to be easy things for me to remember that, and to kind of slow down a little bit too. I feel like I'm always rushing to the next thing because there's only so many minutes in the day and everything takes so much longer with children attached to you. But yeah, really slowing down and being able to make sense of what I'm supposed to be doing, but having a provider that is able to explain it kind of in layman's terms. Because when you say pressure, I have no idea what you're talking about.
Yeah.
So to have someone that's willing to be like, okay, that's exactly what it is. Like, I cannot tell you the amount of times I've been explained what a Kegel is, and I still don't think I know what it's doing.
That's
I'm like,
okay.
okay, like, how important are they? Are we still doing them? Is it detrimental? Do I need to learn?
So it is a basic, I guess, I always use basic because it's all like building blocks, right?
Yes.
And so Kegel is like the isolation of just contracting the pelvic floor muscles, right? And so it's doing like it's a squeeze and a lift with the muscles. But you also need to have the relaxation piece. So that's where people get pelvic floor tightness, when it's like they're at this constant like squeeze and almost like holding it up high. And it is important to, relax them as well. So in a Kegel, you need that relaxation, you need the squeeze, and you need the lift. But so a Kegel is just specifically to the pelvic floor muscles with you can bring in like that you're just doing it like anally. You can do it that you're just isolating to the right side of your perineum, the left side, the front, or you can do the whole thing. So that brings like more awareness pieces, these awareness exercises. I
I
know
have no
it seems
idea.
crazy. But you really can if you actually bring, that's where a lot of like the mental, the mind-body connection, that awareness piece, that you really need to dive in that way. And not everybody needs to necessarily do that, right? But if you are having issues, it's a very important piece to be able to connect that. But that's just looking at like the pelvic floor muscles alone, but we should never just look at just the pelvic floor muscles, because it is a whole body approach. It has a lot to do with, your abdominal muscles. It has to do with your glutes, so your butt muscles, your legs, even like then it goes into posture, like with how you're standing, your feet position, your neck and everything too. Like so many of us, I have such bad like forward head posture, right? And constantly sitting. So it's really like bringing it back in alignment. And you don't want to be a statue, but it can make a difference in what may be actually affecting your issue of the pelvic floor, as well too. So lots, I know when they do a Kegel, they're bringing in other muscles as well. So they may be squeezing their butt, but really your butt muscle needs to be relaxed for you just to focus on just bringing in those pelvic floor muscles specifically. So again, you can do them anywhere. Sometimes it's easier to do them in a sitting position that you may feel more awareness. Some notice it that they can draw them in more when they're standing, laying down, right? So it really can depend on the person. But this is kind of off topic here, but it's within the topic, but not. But it's like bringing a highlight to like sexual function, right?
I was literally just going to bring that up next. I'm like, not only is it just your womanhood, but it's everything else too, right?
Like an orgasm is those pelvic floor muscles, right? And it's doing that contraction. And so after the orgasm, it's important those muscles need to calm down, right? And that relaxation piece is so important. So when you have that awareness piece, then you will understand it more, like, oh, that's what my pelvic floor is doing now, right?
This is why we need people like you.
Yeah.
I'm sitting here, I'm like, am I relaxed? I don't know. Send help.
You do not want to be in a state of like tension all the time, right?
Yeah.
It's fine. It's hard to find balance. It's it's with everything in life. It's all about balancing. So, even if you're not experiencing or say you work on something, right? And it may return though, and then it's like, oh, okay, I need to work on it again. So
Mm-hmm.
yeah, it's not typically like a once and done thing, right?
Yeah.
It's these habits that we may need to keep coming back to.
I always say time and gravity too, right? At the clinic I
Mhm.
work at when I'm not on leave, I
Mhm.
do an internal tightening called plus 90. And so it uses heat and radio frequency to stimulate the tissues. And we usually say like a flower opens up like this, and then with the tightening and pregnancy, obviously.
Yeah.
But when we do the treatment, then it kind of brings that flower back together and tightens everything up.
Yeah.
And that's what I talk about too. I'm like time and gravity. And I'm like,
Mhm.
just like your skin, your tissues are going to lose that elasticity. They're going to,
Mhm.
or your cells. And same thing with your tissues down there. Like they're not going to
Mhm.
stay like you were a teenager when you're, 50.
Yeah.
It's and then obviously childbirth and your sex life and things like that. You're constantly, using those muscles, or they're being stimulated. And so to always bring it back and remind ourselves that it is something that we have to continue doing. And it's like going to the gym with your body. If you want to keep that muscle, well, then you better keep on your workout routine. It's the same thing with our skin and our woman health down there.
Yes. And that skin is very sensitive, right?
Hmm.
So, um, yeah, it's one of those things again that we don't talk about enough, I guess, in a
Yeah.
sense. And that I've seen a lot of posts lately just about vulvas, right? And like the
Yes.
different shapes in a sense, or
Yeah.
what everybody's is different, because again, that the textbooks from a medical, it's a very standard. So then
Hmm.
especially say as a teenager, you're looking at that and you're like, oh, well, mine doesn't look like that.
Yeah.
But it can be so much variation.
Hmm.
So again, it all is within the women's health and that education, and um
And
just bringing that
normalizing
to
too
light.
that they don't all look like that. I
Mm-hmm.
know it was a shock to me when I came into womanhood. I'm like, what? They're not all
Yeah.
the same. And I do Brazilians at work too. And like, whatever, I have my clients wearing panties, but still, they're like, oh, always so shy. I'm like, you've seen one, you've seen them all. But they are so different. And I think that can maybe sometimes bring the shame piece too.
Mm-hmm.
If you don't have that, I always call it a porn star little flower down there, like if you don't have that absolutely perfect, like that's okay. And we can still, you still can be comfortable to find that practitioner to help work with you. And do you find that if we're losing like the strength of our pelvic floor and things like that, if we tighten it back up, do you find that, I don't know how to word this, everything kind of comes back up a little bit? Or have you kind of seen that at all? Does that make sense?
Yeah, but it can be, again, it's that fine line, because some can still
Mm-hmm.
have, you can still have leaking
Mm-hmm.
with a tight pelvic floor. And so it's learning that relaxation piece. And some don't know how to do that, right? So it's not
Mm-hmm.
always about the strengthening piece. And so if it does, get that tightness, you need to learn how to relax it too.
Mm-hmm.
And then you may need to strengthen it a little bit again. But yeah, I do find actually more lean towards the tightness rather than the weakness of the pelvic floor. And so that's where, like, if you're holding tension in other areas of your body, you very well, maybe that's where
Yeah.
you're holding it too, is in your pelvic floor. So that's again that awareness, finding out some, just a general exercise can help, but I really go towards like meditation is a big one that I promote. And so lots of people don't know how to turn off their minds, right? That is a skill. That mindfulness practice does bring in that awareness piece, though. But yeah, it can take time to develop that. And people often want a quick solution or a quick fix, right? But yeah, there's many benefits to that, and even just like regulation, right? Emotional regulation and things to help you even just with your kids as well, right? It's tiring as a parent it's hard to stay regulated all the time when you're trying to regulate them, right? So
I feel like
yeah.
I'm the least regulated person in this house. Oh, girlfriend needs a lot of help over here. But I feel like my body is always in fight or flight.
Yes.
And I'm always holding so much tension. And
Yeah.
so I'm definitely that person. I think it's the tension, and I pee when I sneeze, laugh, cough. And so it's almost like a protection thing for me too, that, oh, if I'm stiff, maybe that won't happen, But I don't even think I realize I do it until all of a sudden you're sitting here talking about relaxation. Like, okay. And then, oh, yes, it was being held so tight, but it's such a subconscious thing that I'm doing.
Right. Yeah. So that is
Oh,
one
that's
step,
interesting.
though. That is great, like awareness that you've brought forth to that connection, right? So now it's just going that further step. So even looking like when somebody sneezes, how are you sneezing and what position are you in, right? Um, so like again, when I talk about the pressure and like the canister, I guess, like the abdominal diaphragm and everything, most likely then, like when you're having a sneeze, you want that pelvic floor to come up and react. And so that pressure, you want it to come up a little bit, but most likely it's going down.
Yeah.
Right?
Yeah, because your whole body kind of
Yeah.
bears down with that.
Yes.
Oh, jeez.
Yes. And so, even if we look in the line, so say like hernias or, like breath holding, say you're moving something heavy, right? And some people will hold their breath. Like that is a big no because then the pressure is going to just like go down again, right? And then that is very typical that somebody then developed a hernia with moving something because they put so much pressure, and so it went out in their stomach, right? Or it could go out vaginally with an organ, whether it be, bladder, your uterus, or like you can have rectal prolapse as well. It would be like for those ones, it's more like an over time. It wouldn't just be because you're holding your breath and it's gonna like pop something, but it's like the habit that over time it kept putting more pressure down, and then it just kind of can give out a little bit, or with the weighted pressure of pregnancies as well. The majority, like the stat is like 50-50 for women having prolapse. Like some don't even know that they have it, and it's not life threatening, with a first degree. There's different degrees of prolapse. You sometimes though can have almost like an irritation, or feel like the heaviness, though often even like UTI type symptoms can display in that too. So there are ways that you can try to, or like work on managing that pressure, and some success sometimes with the exercises can help lift it a little bit more too. There are like pessaries too, to help support the organ if needing. surgery like would really be reserved for those severe cases.
Mm-hmm.
Then
I
yeah.
love that you brought posture into it because, especially a mom of young children, like probably 100% of the time, my posture is not it. And that's, again, I don't think I necessarily relate the two together. To me, it's, I like in the beginning, you said isolation. I very much think, okay, my pelvic floor is one thing, my upper body's another, but yeah, but I mean, it totally makes sense that you need to do one to kind of have the other, you know?
Yeah, and it just, again, it's compensation that happens in the
Mm-hmm.
body, right, of a muscle, and we don't tie up like enough of like even upper body strength that we need for our kids and lifting the things. And
Yeah.
so if we don't have the strength there as well too, again, another area may compensate, and then it's overworked, and then it gets tired and everything too. We sit a lot,
Mm-hmm.
right? Um, so yeah, you can get lots of pain too from not moving.
Yeah.
Right? Movement is so important, even if it's, again, not that like strenuous exercise. Walking is great. Even so, like, one of the things that I really want to focus on when I am nurse practitioner is the return to exercise postpartum. It's not just, especially like there's a whole like research and the protocol on return to running postpartum. So many who are runners and then they just think that they, can start running again afterwards. But to prevent like down the road a issue from occurring, you really should do it like step by step progression
Mm-hmm.
of that. So yeah, there's things that you almost like if you can do this, then you can move on to the next stage, right?
Yeah.
And then work up to that running.
Which makes sense because I mean, if you sign up for a marathon, you're not just going to go tomorrow and run a marathon. You're going to train, train,
Training.
train. And it's like
Yes.
pregnancy and labor and delivery are a marathon of their own.
Mm-hmm.
And I mean, I've seen a lot of women still run in their pregnancies and things like that. But your body is so changed after, whether or not you necessarily feel it right away. And so to have the expectation to just be able to go right back to your normal. And again, maybe you don't have the, you know, not so great benefits of it right away, but it's that down the road thing, a month later,
Mm-hmm.
2 months later. And then all of a sudden we're like I did. I was like, what did I do yesterday? Where it's like, no,
Mm-hmm.
actually, it stemmed from something that happened 4 or 3 months ago.
Yeah.
Bringing it back to that, again, that slowing down
Yes.
awareness.
Yes, 100%. And it's just that bounce back culture still, right?
Mm-hmm.
Which I don't know how you feel about it, but again, maybe it's things that I've seen with, again, the algorithm that but
Yes.
the messaging really to, yeah, decrease that bounce back culture.
Yeah.
So I'm not sure how heavily like it's still out there. Um, but yeah, that recovery really can take even up to that year, right? Like
Mm-hmm.
even to feel more like yourself again. Like
Yeah.
again, this is more personal experience, but like 18 months, I would say, after each of my kids, where you finally get more of that independence and
Mm-hmm.
um just, yeah, overall, like, oh yeah, I'm more than a mom here, right?
Yeah.
Um, so yeah, it does take time to build that again, and so it goes in all realms of your health, not just that's more that mental piece,
Yeah.
mental emotional, but it's also that physical, even if you can't see it on the outside, right?
I
Even
think
all
we
the
reserve, or sorry, go ahead.
That's okay. No, I was just gonna say even all like the hormonal things that occur. Were you gonna say that?
I was
Yeah.
just saying we reserve so much time and appreciation for the hormone
Yeah.
aspect, but more so with the last two, I didn't necessarily have the bounce back mindset for
Yeah.
myself, but my first one, I definitely did, and I did bounce back. Granted, I was 23. And so I bounced back from everything I did. And then with my second, I was like, why is my body not my body yet? And it took so long. And it's like, okay, stop and appreciate what your body just went through. The fact that you're now 3 years older than that. And it was a totally different delivery, totally different pregnancy, right? And I think like, I always sit and I tell my girlfriends, like, "Oh, give yourself grace, like, you're only a year postpartum, whatever," and then with my own babies, I was like, "Why the hell am I not fitting in my jeans yet?" And the same girlfriend was like, "Did you not just tell me what, like, a year ago?" I'm like,
Yeah.
"Yeah, I know," but it's so much pressure on ourselves,
Mm-hmm.
and when you're going through your hormone surges, I am breastfeeding. And so that adds a whole nother thing. And then I'm like, the least my body could do is just look like my old self again. But it's never going to be that. And to appreciate that the external is never going to be like that. And that the internal has changed just as much,
Mm-hmm.
if not more necessarily, because it took the brunt of that weight of the baby and your hips widening to birth this baby and all of those different things. It's hard, I think, as a woman too. We do put a lot of pressure on ourselves to be a certain way, whatever that version of yourself is for you. And when our bodies don't just click back to that, I think it can be hard. So I do love that there's so much more circulating, because I feel like even if you're just scrolling on social media one day and you come across a quote, maybe in that moment it doesn't hit home, but maybe a week later, a month later, you're like, "Ugh, I remember when I was scrolling in that quote, and maybe I just need to slow down and appreciate my body for what it is."
100%.
Mhm.
Yes. And I think so like the pelvic floor course, that's um I think I said the point, like it was so much more than just the pelvic floor focus.
Yes, yes.
And so yeah, it touched on like echoing everything that you just said, and really tied that together and had different professionals interviewed as well.
Mhm.
And so it was good to get those different perspectives, and like everyone, all the healthcare professionals are saying, the same thing. It's just again changing the language, changing society, the expectations. It takes
Mhm.
time, right? Um, so yeah, there's still again lots of work to be done, but I
Yeah,
think we're going in a good direction
yeah,
in that regard. Um, but yeah, it's hard, especially in the public to system to make, to have those changes put into effect.
yeah.
So yeah, I know many of the private services are, but again, it's not everybody can do that, the private as well. So
Mhm.
um, yeah, that makes it challenging. But yeah, social media um, has been great for that with the free posts that are shared, right,
Yeah.
with the information. So
And
yeah.
I imagine it's kind of frustrating too from your perspective of you took this course, you see all the good information, you've personally experienced, you know how important it is, and then it's so easy to just slide this information in and start implementing it, but to put the information into the system to have it implemented, that's the hard piece. Whereas you're just like, let's just do it. Like it's 2025. This is what we're doing. but there's so many regulations and rules and hoops to jump through. And so to be privileged enough to be able to do that private practice, and then you taking it one step further to the NP, that's like so amazing, because I think a very large piece of it too is for women to find a provider that they feel comfortable enough with,
Mm-hmm.
and that will take their concerns seriously, because we can sit until we're blue in the face and talk about our concerns. But if each person we talk to is like, that's normal, that's sickness, that's what we expect, carry on, at what point do you stop trying to ask for help and you just accept that this is your normal?
Oh, 100%. Or yeah, it's really not a band-aid solutions,
No,
right?
yeah,
Like you can't just I again it's learning now because I'll be able to prescribe, but that takes on a whole another responsibility of it. It may help you with one thing, but you may it may cause on a whole nother
yes,
issue, right? So, um, just providing the information, the risk versus benefit, and people need to
yeah,
make an informed decision. But, um, yeah, meds aren't always the answer as well, too, and that's where it becomes important to make those lifestyle changes.
yeah,
But yeah, people need to be willing, as well, and in yeah, timing is everything as well. Like you
yeah.
saying, seeing the post, it may not
Mm-hmm.
click or connect with you that day, but yeah, down the road it may then, right? It's just your mindset that you're in possibly, or
Yeah,
your openness, right? So yeah, I'm definitely, it's again wanting people, yeah, to be heard and valued, and um like that, very empathetic, right?
mm-hmm.
It's and I can't tell, like, if we go to trauma, right? Like, it's not, I can't tell you that it wasn't traumatic. Like, it's what
Mm-hmm.
you experienced, right? Like,
Yeah,
everybody's perspective on the situation will be different. So there's many times that I know we've been, people have been gaslit, right?
mm-hmm.
So yeah, it's finding, you really need to advocate for yourself in the system,
Yeah, I cannot
as
agree
well.
more. And it's the
Yeah.
openness to receive the information. And I feel like as a society, sorry, we we want that quick fix. And I've
Mhm,
been seeing a lot. I'm just going to talk about the weight loss thing in this Ozempic. And
mhm,
it's, we see this, or you see, drink this tea or take this pill and you'll drop 50 pounds this month. It's like, that's not a thing. Like, what
mhm,
are we doing? And so, but we're pulled into that because we are busy. We're busy as a society and we want
mhm,
something to change yesterday. And
mhm,
so keep coming back to that piece that it's time, work, and commitment. And my love for nurse practitioners just keeps growing and growing. I recently changed all of our care over to a nurse practitioner too, because my therapist obviously has set the bar extremely high for me in my mental health. And
mhm,
my doctor, I'm going to talk about the pills thing again that you just mentioned, is it was pills, 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 pills. Here you go. Here you go. And I'm like, okay, so where's the follow up? Where's, like, what can I expect? I'm not prepared, was not prepared for how addicted I was going to get to these benzos and things like that. And there was no follow up. And it was a band-aid. And they weren't
mhm,
asking everything else that was going on. And so I switched to a nurse practitioner, and I was very point blank. I said, I'm sick and tired of, these band-aids, and telling my story a million times. Yeah, you're sitting there kind of listening, I guess, that day because you gave me pills. But to look at the whole part, and then yesterday the nurse practitioner was like, well, do you journal? Do you meditate? Do you do this? And I'm like, this perspective is so incredibly important. And I
Mm-hmm.
think, I think women have different perspectives too, mom to mom, woman to woman. So that was a positive. But also, any nurse practitioner, you've worked on the floor for X amount of years, you have a different perspective to bring into it, as opposed to one day you were just educated to give these medications and things like that and have this right to do so for your patients. But now you've had to work on the other side of it as well and see kind of how have these medications worked? What else did we do at bedside to facilitate your healing or your progress, and to implement that into your private practice, and just again that lens of
Mm-hmm.
being able to offer the full like the full treatment for
Mm-hmm.
people. I think I'm obsessed with the whole thing. I talked to Garth Roswell the one day. He's like, "So how do you think about the nurse practitioner?" I was like, "I'm obsessed with it." And this was before they were even allowed. I'm in Vermilion.
Yeah.
They are now allowed to have a private practice. That's where I went. I said, "No, I'm honestly sad it took this long."
Mm-hmm.
Because
That's
I just,
excellent. I love,
yeah.
yeah, I love those two suggestions that
Mm-hmm.
she gave you. Um, yeah, it's really that holistic view,
Yes.
right? And
Yeah.
I I don't know. Of course, like you don't want to doctors are very like the health system, I think it's the system,
Yeah.
right, that needs to change, and how many patients they maybe see in a day, right?
Yeah.
And I have found it again as a student in my practicum, it is very hard to get through things in 20-minute appointment,
Mm-hmm.
even for what I needed to cover and do my assessment. And then, I'm like, oh my gosh, like I, of course, as a student, had more time. It was okay that I went over.
Yeah.
But I'm like, I can see how difficult it is when you came in with X, Y, and Z, and I need to prioritize that. Like they are all equally important.
Yeah.
Um, but yeah, 20 minutes is not enough sometimes. So,
I think we often
I
forget too that our doctors are just human beings.
humans, yes.
Like, and we're asking them to do the impossible of seeing hundreds of patients in a day. And
Mm-hmm.
then patients are upset when, even with prenatals, you're like, okay, I'm going to drive to this appointment for 5 minutes.
Mm-hmm.
And they're basically just going to look at me and be like, cool, see you in 4 weeks. Um, and that goes with regular health appointments too, right? You're like, okay, I'm going to lay eyes on you for 5 minutes. And at what point, like, all of my concerns are never going to be addressed.
Yeah.
And it's frustrating for both sides. And everybody is so burnt out.
Mm-hmm.
Like,
Yeah.
so we definitely need to hone in on that holistic approach, and where we can slow down and offer more time for our patients, more resources, better outlooks.
Mm-hmm.
I'm all for it.
Yeah, it's all about those connections, and it really is important to know your community,
Mm-hmm.
right? Like if you don't know your community, how are you supposed to refer people
Yeah.
to the programs and everything? So, yeah, that's a huge piece of making those connections. Yeah.
Yeah. And I think there's a lot of good providers around where we are, and to build such a strong community that, you have your little circle of people you can refer to or whatnot, and the standard of care that's being provided, and that your patients are in really good hands. And, there's so much comfort in that, I think, when you can all kind of meet on a ground level and know you're going to care for your patients in the same way as you do. So I
Mm-hmm.
know it's, especially when you're dealing with women's health, prenatal care, pregnancy, postpartum, I just hold it so near and dear to my heart. And these women, we're seeing them in such like a fragile time, especially postpartum with the hormones and things like that. And the postpartum checks, I think, that are being done, of like, oh, are you sad? Do you cry? Okay, you're it's normal, and then you're sent off. Or it's just like, oh, you're healing physically, great. Or how's your emotions? You're like, I don't know, good, I guess. I just had a
Right.
baby. And so, yeah, bringing all of those important pieces back together. But
Mhm.
one more final question I had for you is you talked a lot about like the abdomen and things like that. How do you
Mhm.
or would you support like a post C-section mom in that in terms of how it maybe relates to her public health? Oh my God. Pelvic health
Mhm.
and how to strengthen that after.
Yeah, so it's not even just C-sections, right? It's
Mhm.
definitely vaginal births too. Um, every woman will separate their abdominal muscles. So as your belly is growing, the line down the middle, that linea alba, it's the connective tissue, will separate to a certain degree. Some will come back together. Postpartum, it can take up to a year, though, for it to come up together or back together without doing any rehab exercises. And so the research has really changed. Like even so the course that I took, they're now on the third, I guess, edition of it. So when I first took it, it was the 1.0. Then I received the 2.0 as well. And so even the messaging for the rehab of those abdominal muscles had changed a little bit from the 1.0 to the 2.0. There's a 3.0, which I'm had started, but then kind of took a pause because it goes very in depth again and with school. So yeah, I'm excited to see how, if there is any updates there. But really before it was very structured, like be careful about the stress that you put on your abdominal muscles, right?
Mhm.
But now you also need like a certain amount of stress of the tension to those muscles for them to actually heal. So that's, for example, like if you wear an abdominal binder
Mhm.
after delivery, I would only wear that very temporary because that is to help support, say, your stomach, your core, the pressure even, right? Um, and if you use it for too long, they don't know how to work on their own. They are constantly like something is helping them, and then you need to actually learn how to engage them by yourself. So yeah, um, there's like four different abdominal muscle groups of the layers, and so that's where the assessment is important to see with the breathing and the movement pattern, because some people will recruit a specific layer and not recruit all of them. It really depends on the intention or the movement that you're wanting to do to bring the muscle on board, right? So there's certain exercises that can target, again, the specific layer,
Mhm.
or a specific strategy that, like, when you incorporate the breath in it, it's what part of the breath that you focus on will then target that specific muscle in your stomach. With specifically C-sections, though, I will say the scar tissue is a big thing. Lots of women um, even talk about like not getting the sensation back to the area, right?
That's me. Yeah.
Yeah. And so if we think about like with episiotomies, pelvic floor therapy is recommended to work on that scar tissue. And we don't often talk about it with C-sections,
Mhm.
right? Any surgery actually can create scar tissue. And so you want to bring the sensation back to the abdomen and work on that scar tissue as well too. So once everything, of course, is healed, externally, the typical is that 6 weeks for healing. I would even go longer than that. Of course, it depends on, other factors for the person too, for their healing, even if it looks healed on the outside, thinking of all the layers that they went through. So I wouldn't go intense at the beginning, but just to bring, again, the awareness, piece to it. And I usually tell people like to start with even like a feather or like a makeup brush, and to start bringing like the sensation back to the tissue. So thinking about how it feels before, and then, going over the area, you want to go around the scar as well, and then over the scar. And then thinking about how it feels afterwards. And so that is resetting that neuro pathway, the neurons going to that area when you look at it from the before, during, and then after, right? And so again, it may, at the beginning, you're like, this is like hocus pocus, like what is this, right? But again, over time, it will reset. And for how long it takes is going to be very individual, right? Yep. But then over time, you do work up to going a little deeper then, and doing a little massage around the area. Again, going around the scar, and you will go on the scar. And it just helps, loosen the tissue up. So sometimes, again, if there's restrictions to the area and the tissue's so tight, you're not going to be able to, like, say you have a diastasis, you're not going to be able to bring those muscles back together because that tissue's just so tense, and, the adhesions that are underneath. And you may not get it fully out if there, you feel like a little almost like bump or like nodule, right? Because it can be deeper, and the only way to get that out would be to surgically remove it too, but then again can cause more scar tissue again. So, but yeah, the massage definitely is important. And yeah, I would recommend like anybody who had an episiotomy to, do that internal work. Definitely a pelvic floor therapist will help you. Will show you how, will do it with you, but then they'll teach you how to do it on yourself at home. Any type of tearing, of course, could do it. But yeah, you're more likely going to, you're going to notice it more or know what to massage with the episiotomy. And then, yeah, of course, with seeing the C-section scar, to massage that area.
I love that you brought up the episiotomy too, because I think that's an important area that we could focus on too, especially I think a lot of women, if they've had an episiotomy, that wasn't in the plan.
Yeah.
And so to know how to, rehab after that. How long would you say to use an abdominal binder if a woman wanted to do that after C-section?
So again, everybody would be a little bit different. Like 6 weeks is a long time, right?
Yeah.
Like the 2 week roughly.
Yeah.
I would say. And then after that, even if you want to do it every like second day, or depends what you're doing. If you're going out for a walk and like a short walk at that time, I would probably use it to support a little bit yet. But it will feel weird if you've been using it then for the 2 weeks and then you take it off and then you're like, oh my God, I feel like my insides are going to fall out. But that's because you, again, that was supporting it, and then you have no core strength. So you do need to, build that up, and all it is time, right?
Yeah. No, I think that's very important because
Yeah.
I've had a few girlfriends that absolutely swear by them,
Mm-hmm.
and I never did use one. And so I was like, oh, maybe if I decide to have another one, I'll use one. But those are some very good points to think about for sure.
Mm-hmm.
If people want to find you, how do they do that?
Yeah, they can reach out to me on Facebook Messenger, Instagram. They can DM me. They can connect through my website, pelvichygge.ca. As well, if there's ever any feedback, I'm always open to constructive feedback too, that it would be anonymous. If they, do the add a comment on the website, it will be emailed to me. So yeah, they can connect that way, or email Ashley at pelvichygge.ca, and then by phone or text as well. My number's on my website there. Booking, I'm only have the prenatal class series on my booking right now. It is free, my prenatal classes. I've opened it up to anybody who wants it. They just have to create an account through the pelvichygge.jnapp.ca. So yeah, they create an account, and then I will get notified once they book an appointment. The booked appointment, it doesn't have to be, they don't have to show up for it. It's just, again, a technicality. And then, I will send them the presentations. But yeah, if anybody wants a specific, like an assessment, they can just reach out privately just to arrange a time that works for both of us.
Sounds good. And I'll put all that in your little show notes too, so it'll be easy for people just to click and go. Well, I'm so proud of you for everything that you're doing. I can tell you radiate your passion in this, and I just know that if anybody has you as their care provider, they're going to be so lucky, and I cannot wait to see what you do. The world needs more people like you to support all these moms to be moms and, just women going through this journey, right? So thank you for taking time out of your busy studying mom schedule to share all of that with us. There were so many good points, I know, even for myself. I can only imagine that others will take all the goodness from this as well. Thanks for listening to this week's episode. Please take a moment, and on whatever app you're listening to us on, press that follow button to stay up to date with all future episodes. If you or someone you know are interested in being a guest on the Beyond the Birth Story podcast or a sponsor, please visit our Instagram or Facebook at Beyond the Birth Story podcast and send a message or fill out that contact form. I would love to connect with you. As always, remember to be gentle, kind, and hold space for yourself when you need it.